and we are back. Today we were talking about something that overlaps a lot with kind of common patient complaints that we have even on the eye care side. So that is talking about veins, like spider veins, varicose veins, visible veins that either you just don't like or they've been there for a while and you want them gone. So that's kind of what we're covering today.
Yeah.
So
I feel like even people who maybe wouldn't necessarily gravitate towards other aesthetic treatments, like, would love their spider veins gone.
Yeah. Tell us a little bit about what kind of veins you can treat with this, and then kind of what the treatment is, honestly.
Yeah, so we can target a wide range of veins with our laser. Anything from tiny little facial spider veins to a little bit bigger veins on the legs. The only thing that we can't treat is those big, juicy varicose veins. If they're kind of three-dimensional on the leg and you can see them and feel them poking out, that's where you really need a vascular specialist. But anything that's flat, varies in size, color, anything like that, we can treat with the laser. And it's pretty easy. So the laser targets the hemoglobin in the vein, gently heats it and causes that vein to collapse and the body to reabsorb it.
Yeah, that does sound scary, but these veins that we're talking about are like little tiny accessory veins. Like, it's not like we're shutting down the main arteries in your body. That's why you don't want to do those big three-dimensional veins.
Right.
So it sounds kind of scary, but it really is totally fine.
These are very small, really not super functional veins that just have developed and become more prominent as we age. So it's a very complex network of vessels and veins that provide blood flow to the area. So you're fine by getting rid of a few of the ones that are bothering you.
Also, the ones that are very close to the surface.
Right.
Describe kind of how patients describe the feeling. A lot of people, want to do it, but they're like, it's a laser. So
yeah. So it ranges a lot in how it feels. So areas that have more hemoglobin or more pigment, they're darker, deeper veins, those are going to be a little bit more uncomfortable. And then those small little tiny spider veins that we chase after aren't very uncomfortable at all. Yeah. So it's a wide range. I'm able to kind of warn you before we go to a sensitive area that ankles are very sensitive.
As I know.
That's one of the more sensitive areas. But for the most part, it's pretty comfortable. We do use numbing cream. They're usually with every treatment, there's a couple veins that I'm like, hang on, this is a big one. And it feels like a hot rubber band. And sometimes you can kind of even feel it up your leg a little bit. But as far as pain goes, I would say most patients say it's maybe a 4 or 5 out of 10.
Yeah, it's also very short-lived. So the laser fires and then that spot is kind of done. So
yep. It's not prolonged.
So how oftentimes just like laser hair, you need multiple sessions of this. So how many treatments do you normally see that patients need? And then kind of what's the downtime afterwards?
Yeah, so for the smaller facial veins, I have some patients who are happy after 1 or 2 treatments. For the bigger areas, the legs, people with more veins, usually we're going to end up doing around 3 to 4. So it varies. I'm usually able to kind of guess that ahead of time. But for most, I say expect a couple more. And usually the lower it is on the leg, the more the body struggles with the blood flow and your vessels and valves to keep it pushed back up in the system. So there's just more pressure down there. So sometimes those will need more. So ankle veins, calf veins typically need more treatments.
And then downtime?
Downtime, I want you out of the sun before and after the treatment for at least 2 weeks. So it's kind of tricky in the summer. If you're someone who wants to lay out and you want your leg veins zapped, it's probably not the best idea. But if you're somebody who has good habits in the sun, you can do it anytime. So staying out of the sun, if they're really low on your legs, I like you to wear some compression stockings for a couple days afterward just to make sure we have that blood flowing good and no blood is pooling in those little vessels we try to destroy. And then no heavy exercise that afternoon if we're doing the leg veins. But outside of that, there's not much downtime. You may have some redness, swelling, sometimes even bruising in the area, but that's it.
If you have any questions about treating your veins or want to know if it's possible, I always recommend that you come in so Liz can lay eyes on it. It's super easy. Most times we can do a consult and treat same day without a problem.
Yeah.
If you have further questions about pricing, just go ahead, give us a call, text us, and let us know.
Yeah.
We're happy to help.
We'd love to see you.
Yeah. And your veins.